I'm Andrea Masperi. I'm a radiographer from European Institute of Oncology in Milan. And today I got to discuss what about, in my opinion, is and will be a very important topic in the future of radiology. The project title is Green Radiology, a pilot study for a sustainable radiology project. I declare that I have no conflict to disclose. Despite the few studies on this specific subject, it has emerged that the environmental impact in radiology is not only influenced by the use of large equipment, but also by the different elements involved in the whole process of radiology. So the purpose of this study is to estimate the energy impact in the radiology department and implement a sustainable solution in a testing period and evaluate the effect. So the project was conducted between January and June 2023, followed the UNICEF certification energy diagnosis phases. The initial stage involved the categorization of departmental functional units, and we identified two main categories. The first was imaging functional categories, or EFCs, that directly contributing to diagnostic process, such as equipment like CT or MRI, for example, and complementary functional categories, or CFCs, that's indirectly affecting energy consumption with elements like reporting workstation or CD burners. The second stage involved monitoring, examination, and their respective activity timings by dividing into three periods: on, standby, and off. The third stage focused on determining energy consumption and identifying critical categories, and the units were considered energy inefficient if their idle consumption exceed over the 30% of the total consumption. So the analysis mapped the activities and the energy consumption of the functional categories, so the EFCs and CFCs. The energy consumption is the result from the product of the average power declared by the equipment manufacturers and the duration of both active and inactive periods. So 5 EFC and 4 CFC were defined as inefficient respectively. So we proposed 4 interventions. The first was the reallocation of diagnostic activities for critical EFC through a redistribution of examination during fixed days, or by scheduling a patient differently by allocating slots per patient instead of per anatomical regions. Optimization of consumption for critical CFC, as example, by working directly on activity and idle times, operating directly on consumption in the on and off phases. Then we proposed a green imaging review for patients accessing emergency room. At last, we proposed a staff training, and we wrote an energy scorecard by me and my colleague Fabio. During the test period between May and July, we implemented this proposed action and monitoring critical EFCs and CFCs for energy consumption and applying the green imaging review. So the first results we obtained was a reduction in total energy consumption of 8% for EFCs and 31% for CFC, against an increase in average diagnostic activity of 11.8%. The green review retrospective analyzed the radiological examination request for abdominal pain. As suggested by the literature, we considered alternative imaging methods with lower energy consumption, such as US ultrasounds, with the same diagnostic accuracy instead the standard imaging such as X-ray or CT. So we identified 22 patients with suspected abdominal pain, 5 patients with a renal colic picture, 6 patients with abdominal pain and suspected hydroxyurea levels, 8 patients with abdominal pain in chronic liver disease. The data were anonymized and evaluated by an independent radiologist, and 156 patients were evaluated, recording a potential reduction in energy consumption of 378 kilovolt per patient. So we identified the conclusion. So identifying inefficiency and non-compliant devices with European energy guidelines is possible. So involving radiographers in energy reports could save energy, money, and can improve assistance quality. In the test period lasted from May to July, we saved around of 12,000 euro. And we identified also 2 limitations. First, the first was we only considered the electricity consumption and not from other sources. So the first solution could be also to evaluate other sources of consumption such as CO2 emission drawing from the manufacturer's environmental declaration. So the green protocol limitation include evaluating simulated patient in a limited time frame focused on abdominal studies. So this is the last limitation. I was also to thank you for your attention. Thank you.
Thank you for your kind introduction. Today we are going to speak about sustainable practices in medical imaging departments. I do not have any conflict of interest to disclose, and this is the plan of today. So when we talk about sustainability, it's important to mention the Brundtland report of 1987 that states that every environmental problems are related to the fact that South countries, more low-income poor countries, have great poverty, and to the consumption and production patterns of North countries, which are high-income countries or rich countries. So 20% of the world population, so concerning the rich countries, is responsible for 80% of the accumulation of CO2 and other gases. So this highlights the need for a strategy that combines development and environment. So we have this new concept, so sustainable development, which states that development that meets the needs of the present without compromising the ability of the future generations to meet their own needs. So we have 3 main pillars here: environmental sustainability, social sustainability, and also economic sustainability. So these 3 pillars are closely interrelated, and for this study we focus on the environmental sustainability. So multiple studies highlighted that medical imaging and radiation therapy departments are big resources consuming, which heavily contributes on the footprint of healthcare systems. And the purpose of this study is to identify the most adequate combination of the purpose of the study was to identify approaches that can reduce the environmental impact of medical imaging departments. So we did a scoping review based on the GPI methodology. So we included studies about environmental sustainability and practice in medical imaging departments, and that were published after 2013. And we excluded all the studies concerning nuclear medicine and radiation therapy. We collected data from Medline, CNL, and Embase, and multiple keywords combination and mesh words related to environmental sustainability were used. We used Zotero software to remove duplicates, and Ryan, a web-based tool to screen abstract titles and full text. So we did this job with 3 independent reviewers. Then 2 independent reviewers extracted data and performed descriptive analysis and a narrative summary. So from over 4,600 studies, we only included 42 studies. These studies are mainly conducted in developed countries and published after 2022. And the main modalities that were concerned were MRI, CT, interventional radiology, or mixed studies with multiple modalities. Main topics emerged from our study for eco-friendly practice concerned justification of examination, energy consumption, waste production, recycling, use of local resources, environmental pollution, and education. So here I will give you some tips and advice on what you can do in your practice. This is not exhaustive. We don't have the time today, but we should improve appropriateness of medical imaging investigation requests. We can do it with algorithms or pre-authorization system working in collaboration with radiologists, for example. We should reduce energy consumption related to electronic devices, as it was mentioned before. So turn off the machine, computers, or lights in your departments when it's not needed. It's better to choose multi-use material rather than single-use materials, so to reduce packaging. And concerning recycling, we should reuse equipment, so we can send it to other countries, so we can use it for education, for example, and we can also recycle waste. It is also important to prioritize the use of local resources. So in one study, they highlighted the use of local ultrasound gel production. And we should also consider alternative means of transport or hybrid working models. So for example, everyone came here to ECR. Did you take the train? Did you take the bus? Or did you take the flight, for example? And we should also integrate sustainability environment education program for sensibilization already in the undergrad students. So to reduce the environmental impact of medical imaging department, it's important to educate healthcare professionals, to reduce unnecessary examinations, to control energy consumption, to reduce and reuse and recycle materials, and to rethink for transport and working models. So further studies need to be conducted to identify the most effective strategies in supporting the decision-making of managers and the medical imaging professionals. And concerning further work, I think the next step will be survey interviews to map opinions about sustainability of radiographers, identify facilitators and barriers to implementation, and then define implementation strategies. And then finally, what would be interesting is sustainability could be a quality measurement actually for clinical audits or for decision making. So thank you for your attention.